So good evening, everyone. Myself, Dr. Tanima Singhal, and I welcome you all on today's Q&A session. So you can put your questions in the chat box and I'll answer them. I will answer them. First, I'll take the questions which you all have filled in the Google form, and then I will take the questions which are live. So you can keep putting your questions in the chat box. Till then, let me take the questions which are there in the chat box. Sorry, in the Google form. First question is from Afshan. Hi, I am a twin mom. My son is 3 months old. To latch, he was late. I think you're asking the question. Okay. So basically, your question is not clear, but what I'm understanding is you have twins and they're 3 months old and they're not latching. So first of all, Afshan, can you give me a little information about what is your milk supply for 3-month-old baby? What all you have done till now for last 3 months, and what is your milk supply? How many times you're trying to put them on for breastfeeding? Like all these questions, please let me know so that I can answer them properly. For now, I can just say that if your milk supply is very good, then for every breastfeeding sessions, just try to put them on the breast. So just try to do direct feeding trials. And if your milk supply is very low, then first work on building up the milk supply, because for 3-month-old twins, milk supply should be good for them to put them for the breastfeeding. So first, try to work on your milk supply if your milk supply is low. And if your milk supply is good, then obviously we need to start working on putting them on the breast. So I need some history behind them, like what is happening, what all you have done till now. Then I will be able to answer it in a better way. So next question is Chetra. Chetra says latching problems very painful. So always remember, girls, if anybody has any issues related to latching, like specifically when I talk about latching issues and painful latching, then obviously you need to first understand that latching problems will only come specifically when you are not doing a deep latch. When it is a shallow latch, then obviously the baby will like latch on only on the nipple. And when obviously when the baby is latching on the nipple and we are doing multiple times direct feedings, then due to this shallow latching, you will have pain. You need to make sure the baby latches deeply and not the nipple part, basically the areola part, so that the baby gets the milk faster and it is not painful for you. Next question is mostly low milk supply. I'll answer them. Surbi Pathak says low milk supply and baby likes formula milk than my milk. Okay, so basically, see, though babies don't have any preference for formula. It is basically because it is easy for them to drink from a bottle, or it is easy because the flow is good. That's why they prefer formula milk. Suppose you are giving your breast milk in the bottle, they will also prefer that. So it is not like that they are preferring formula over breast milk. It is basically the ease of drinking the formula through a bottle that makes them like towards the formula milk. Okay, so don't worry about that. Next is from Adela, low milk supply and baby rejecting breast. So your question itself has the answer. If your milk supply is already low, then why will the baby cooperate on the breast in a better way? So few babies do cooperate. So today I had a mother whose baby is around 2.5 months old. She has no milk supply. It is all dried up. But when she's putting the baby on the breast, especially in the night, the baby is sucking on the breast. Basically, the baby is doing a pacifying with that. So here in this case, the baby is latching, but you also need to understand that the baby is latching in the night due to maybe like a pacifier. So here we first need to work on milk supply so that the baby latches properly and gets the milk what is the baby's requirement, as per the baby's requirement. Next question is from Priyanka. Tips to increase milk supply during periods. So always remember, girls, during periods, because your body is already in a deficient stage because it is losing blood. So what will happen? Your body will conserve the nutrition for its body. So during periods specifically, just have good hydration. You need to maintain your water intake much better than what you are doing in the usual days. Second thing is you need to work on your protein intake, your iron levels, and your calcium levels. These three things are anyhow they're important, but during periods you need to work more on this. Try to have your meals more nutritious so that during periods your body doesn't go in the nutrition deficient state. it should be like good nutrition should be there during periods also. In fact, extra nutrition during periods, which will help your body to compensate the blood loss and will also keep making milk supply as per the baby's requirements. Next question is Bhagyashri, low milk supply and latching sucking issue. Okay, I'll cover that. Next question is from Jalpa. Low milk supply and baby urine not pass as normally issue. If your baby is not passing urine count like as normal, but if the baby is gaining weight properly, then please don't worry. But you need to keep a track of baby's weight every 3 days if it is happening, and also you need to make sure the urine passed by the baby is what is the color of it. If it is dark yellow color, that means it is the baby is getting dehydrated. So you need to reach out to your doctor immediately for that, or keep giving more milk to the child. If the urine output is very less and it is also dark colored urine, then it is a concern for dehydration. Next, mostly low milk supply and Netra, I have stopped medication for 2 weeks. Can I restart now? Yeah, definitely you can restart. Megha, milk is not producing, baby is not latching. So your answer is there, because milk is not producing, so baby is not latching. So first work on your milk supply. Veena, latching as my baby's birth is preterm. Okay, got it. But there is no like any kind of thing that preterm babies can't latch. So basically, even babies can latch. The only thing is the milk supply and the right latching techniques, and also the milk flow. Kalyani, I do pump regularly after each feeding session, but my milk supply doesn't increase. I am following all protocols as per the saying by the clip in the clip. Okay, so you mean to say the whatever things I advised during these Q&A sessions, you're following that, but your milk supply is not increasing. But I have also told you to track. Are you tracking your baby's weight, and are you tracking the baby's formula? If yes, please let me know in the chat box so that I can help you out in that. Next is Ima. Low milk supply, then I currently using formula milk and need back to breastfeeding full enough for my baby. So low milk supply, I'll just cover just a minute. Kavitanjali, my baby is not ready to latch from last 2 days. Okay, it might be a temporary thing because last 2 days only the baby is not latching. So just keep patience. Have a lot of skin to skin with the baby will latch again back. Gauri Priya, flat nipples, latching problem, low milk supply. So flat nipples, you have to follow a deep latching technique. In specifically cross straddle hold works very well for flat nipples and inverted nipples. So latching issue and low milk supply is causing the latching problem. So first work on your low milk supply. It says low milk supply and nipple soreness. So nipple soreness will be there if your baby is latching shallow, only on the nipple. So make sure that baby latches deep. Okay, so now one more common question is low milk supply. So let me answer that. So for low milk supply, you need to follow three major things. First is demand creation. So what you need to do for every demand of the baby, like whenever the baby is demanding milk, you first need to first try the baby for the breastfeeding. If your baby is coming on the breast, but still you're not sure is the baby drinking or not properly, then you need to pump after it. If you have tried, but your baby is not at all coming on the breast, then obviously you have to pump. This is about demand creation. Second is preparing your body and mind. So you need to maintain your hydration. Do for flow, do oil massage and warm compress. For nutrition part, take galactocox like lactomagic powder and Morico tablets. Next thing is keeping the baby skin to skin with you. And the third process is tracking. Track your baby's weight and track your baby's formula intake. So these three steps you have to follow for low milk supply issues. Next question is from Shrutika Kalghadgi. Whatever medications you have given, how many days should we continue with them, especially the Domstal pill? So always remember, any allopathic medicine has to be taken under only doctor's guidance. So if you have already taken consultation from us, we always tell you for how many days you need to follow and then get back to us. So Shrutika, we would have already informed you that you need to take it for how many days, and next call is always given by our doctors or me. So if your date is already like not crossed, then you have to follow till that day, and then on the next call you have to discuss about the next protocols, next doses. If that date is already passed and you have not taken the consultation yet, then you need to book the consultation so that based on whatever has been the results for last whatever time you have spent, the doctor will see the results and accordingly will change the dosages accordingly, Shrutika. Next question is from iPhone user. At present, XML quantity being pumped every 3 hours as baby grows, requirement increases. How to meet out the demand of the baby? So this you don't have to worry about. The nature will take care. Your work is to keep creating the demand and keep following the protocols. And you need to keep a track of baby's weight. So if your baby is gaining weight steadily, then you don't worry about how much milk I do need to make. That nature will take care. Your work is to just keep creating demand. If you're feeling that the baby is not gaining weight and I have to give formula to do that, then you have to work on your overall the 3-step process which I told you. That will improve your milk supply overall. But right now, when you ask that how much quantity I'm pumping, you don't need to see the quantity. Please don't do that. Just track the baby's weight, track the formula. If you're not giving formula, then whatever amount you're giving is perfect. As the baby will grow, the body will adjust as per the demand of the baby. You just need to keep a track of baby's weight, and overall, you have to take care of your body's nutrition. That's all. Question is Shrutika says, okay, thank you. You're most welcome. Any other questions, girls? Anybody has any questions? You can put it in the chat box. Otherwise, we can end up the session today because I don't see any new questions. Okay, girls, so I don't see any new questions. So that means the questions are answered for today. That's all. Take very good care of yours and please keep moving. Never lose the trust on your body, on yourself. If you can nurture your baby during pregnancy, you can do it even now. So please just have full faith on yourself. And remember, there are a lot of couples who are still wanting a child. Infertility has become a very big problem these days and you have already delivered a baby. So have full on faith on yourself, have full on trust on yourself. You will definitely, exclusively breastfeed your baby and never give up. If people are around you telling that give formula, you are not producing enough milk, please don't listen to them. Just work on your overall breastfeeding, keep tracking baby's weight and keep working, keep focusing, keep your peace there. With a peaceful mind, you will be able to raise a peaceful baby. If you're always stressed out, that aura will pass to your baby also. So you need to be stress free, you need to keep peace, you need to keep calm. And whenever you feel that it is not happening, please seek help. A professional help is very much required. Lactation is also a medical issue. Your baby's health foundation, the baby's future foundation of health is based on whatever you are doing for your child today. You can give the best clothing for your child. You can give the best toiletries like best cream, best shampoo, best soap. But the milk which you are giving to your child, that is the most important thing. The clothes and etc. can vary, can be little cheaper, but obviously, but the breast milk, that has got no cost in it. Okay, you can save your money on the external things, but please invest in a professional support to get your breastfeeding issues resolved, because that is the most important thing which is required for your child at this stage. Okay, that is the best gift you can give as a parent, as a mother, as a father, as a overall parent for your child. The right foundation is very much required for your baby's overall health and immunity. So that is the message for today. Take very good care of yours. All the best, everyone.